Continue to grow aggressively in the DMV. There's also RSV that can impact young and older adults to watch out for. Dr. Jennifer Primeggia, infectious disease physician at VHC Health, joins me now. Thank you so much for taking time out of your busy day to join us.
Thank you.
So let's start with the flu. We know vaccination rates are down for the flu, but we're seeing the highest flu levels in 25 years. What else is driving it this season?
Well, unfortunately, this year we do have some vaccine mismatch, meaning that the vaccine we have this year doesn't provide optimal protection for the flu, but it still protects us from coming down with severe flu. It reduces our hospitalization rates and our risk of more severe complications. So while the messaging has been that there is a mismatch, there is still benefit to the flu vaccine. So I would still encourage people to go out and get protected at this time.
And we were also hearing reports of hospitals nearing capacity, in some instances 130% over capacity. That sounds very concerning. What does it mean for patient care?
For patients, our goal is to keep them out of the hospital. This means try to test them early. And if they test positive for flu, to get them on treatment early, such as Tamiflu, to prevent the risk of complications and to reduce the risk of transmission to others. For those in the hospital, we do accommodate them, but it is challenging.
All right, let's get to RSV now, also a serious illness where we're seeing a rise. The symptoms often mimic the common cold. When should we seek medical help and get tested?
So RSV can be a very serious infection in those of extreme age, so the infants and the elderly. And, children don't need to have very high fevers to still become very ill. So if you're seeing any difficulty with breathing, any gasps or gaps in breathing, or difficulty feeding, that is the time to bring them in because they can decompensate very quickly. And the same would apply to the elderly. If there are issues maintaining hydration and with breathing, bring them in to be evaluated.
And when it comes to RSV, we know this week the CDC, they overhauled its recommended childhood vaccinations. RSV was one of those that they've changed their guidance on. What does that mean for specific groups that may be considered at risk?
Sure. Well, the CDC data from this last year actually tells a very striking public health success story. Since the introduction of maternal RSV vaccination and antibody administration to babies, we've seen the largest decrease in RSV infant hospitalizations in U.S. history. Last season alone, infant hospitalizations fell by 43% and by over 50% in infants under 2 months old. That was our most vulnerable population. But what was especially striking about this was that we didn't need to achieve universal coverage to see this impact. In 2024, about 30% of infants were protected, and in 2025, about 66% of infants were protected. So with this CDC guidance that's shifted from universal prevention to making shared decision making, the success of this intervention will really depend on what the vaccination or the protection rates will continue to be. Given what we've already achieved with 2/3 coverage of infants, I'm hoping we will continue to see future reductions in hospitalizations and healthier babies in the years to come.
Okay. And finally, Dr. Hare, when do we expect this season to peak in terms of cases?
So the peak it depends on the region, but in this region, we're looking at a peak hospitalization between December and February. So unfortunately, we still have about a month and a half to go.
Okay, so meanwhile, cover your cough, wash your hands, any other guidance, stay home if you're sick, right?
Absolutely. Stay home if you're sick. You may feel okay and just have a mild illness, but if you transmit that to our vulnerable populations, infants and elderly, you can give them a very serious infection.
All right, Dr. Primeggia, you stay healthy as well. We need the doctors like you to help everyone who's seems like they're battling something these days. Thank you so much for your time.
Thank you, Michelle.
All right, still